Today's commencement speaker, Dr. Lisa Killinger, graduated from Palmer's Davenport campus in 1983 and practiced in California and Pakistan until 1991. She began her career at Palmer as an instructor of research in 1994, moving up the faculty ladder in both research and diagnosis to become a full professor in 2008. She was named Director of Diagnosis and Radiology in 2006. A prolific researcher and writer, Dr. Killinger has served as a consultant for a number of organizations, helping to develop the Straighten Up America Spinal Health Initiative module for pregnant women and best practices document on the role of chiropractic care in health promotion, disease prevention, and wellness. She also has administered numerous research grants, especially on healthy aging, for such prestigious organizations as the United States Health Resources and Services Administration. One grant she's administered from 2001 to present funds Palmer students going on rotations at the University of Iowa's Iowa Geriatric Education Center. Dr. Killinger has authored 36 articles in peer-reviewed journals and 62 book chapters and other articles. She also has presented at conferences worldwide on topics such as chiropractic care for the elderly and healthy aging. Please join me in welcoming Dr. Lisa Killinger to the commencement stage today.
Class 151, Palmer faculty and administration, family, friends, guests, welcome. What a joyful occasion this is. Maybe a little bit more joyful for you down there, a little bit more terrifying up here, but you know what I mean. None of us got here alone. It's always good to remember that and to be thankful of our family, our friends, our teachers, and others who have helped each in their own way to bring you where you are here today. After the ceremony, make sure and give them all a hug, all these wonderful people who are here in the audience for you today. Many of them have supported you all the way through your Palmer experience. Appreciating others is a sign of outstanding character and humility, and these are two of the most important attributes a professional can have. I'm honored to be here today and to give you one last very short lecture, only 10 minutes, and send you on your way to begin your new lives as doctors of chiropractic. What a wonderful thing to be. We're so fortunate to get to be chiropractors. We get to set our own hours, work as few or as many days as we want. We get to practice in a very wonderful office environment, sometimes that we got to design or decorate. We get to provide chiropractic care, the thing that we love to do, which is a very positive interaction. And then our patients actually look forward to coming and seeing us the next time. It's a great gig if you can get it. In Class 151, you have earned the right to have that really great gig. Now you just have to go out and make it happen. 31 and a half years ago, seriously, I'm old, I sat in a room just like this, ready to cross the stage at my own graduation. So I know exactly how this feels for you today. It's a giant relief, and happy, and exciting, and scary, all these emotions rolled up into one. You've learned so much in a relatively short period of time. You've learned that there are a lot more muscles, bones, nerves that you ever even imagined were possible. You learned where they originate, where they insert, what fosses they run through. You learned what nerves innervate what, and you learned it all. Well, a bunch of you just learned most of it, but that's okay. This knowledge will really come in handy when you start your chiropractic practice. I hope you'll keep on learning. A stagnant mind is a terrible, terrible waste of potential. Be open to learning something new every day. Now you get to transition from the life of a full-time learner to the life of a full-time teacher. You're going to be teaching patients every day the skills that they need to achieve their full wellness potential. Don't get too worried about what you think you don't know about chiropractic practice. It will come. That's why they call it practice. In first try, you learn right off the bat that not everything is textbook. For example, you learn that you can have a simian crease and not have severe developmental delays. In fact, a person can have this genetic phenomenon and can still grow up to be a very productive member of society. The lesson you should have learned from that is to be mentally flexible and not to assume that your patients will follow all of the rules that you learned in those many note sets that you read. Think critically and be ready to think outside that proverbial box. And before that tough number one try ended, a member of your class taught us all a very important message. He fell down, and he fell down hard. But he didn't complain, and he didn't blame anyone. He just jumped up and said, "I'm good." And the lesson here, if you're paying attention, is that we can't always control what happens around us, and even sometimes what happens to us. But we absolutely get to control how we respond. Thank you for that inspiration. A few of you had some children along the way while you were here at Palmer. I don't even know how it's possible to get through Palmer with kids, but somehow you learned to juggle work, school, and kids. Well, I don't think you actually really juggled your children, but, well, maybe Dylan, I don't know. I've seen him. I'm not sure how you managed, but you did it, and it's an amazing accomplishment, worthy of a whole separate award ceremony. And then George, sweet George, taught us all that no one should ever judge a book by its cover. Sometimes class clown and genius are rolled up in one slightly disheveled, yet much-loved wrapper. George, we're all going to miss you. The lesson here is your patients are going to come to you young and old. They're going to surprise you with talents and traumas and stories that you didn't expect. Take time to listen to them and learn about them. It's going to be so important for your patient care. We also learned that with months of planning, Milad can grow the necessary facial hair, up to and including mutton chops, and assemble the perfect wardrobe to imitate just about anyone in your class. He always stopped to my office first to show me the costume before he unveiled it to you guys. And by the end of your first year, Jordan Stenzel wowed Dr. Bogle and all of you with his lightning-fast toggle. He won that coveted toggle-off championship, setting the bar really high for the rest of your class to aim for in honing your technique prowess. Also, by the end of the first year, we all knew that this was a class to remember. You showed us something about pulling together as a Palmer family. You helped raise money for Josh, the student who got a brain tumor during the first year at Palmer, and Josh will be graduating in a few tries against all odds, in part due to the help that he and his family received from your class and others who understand the value of helping others. Your class also showed what a huge collective heart you have by when Dr. Barber shaved her head and she showed up to school and you were wearing those lovely green Barber's Baldies t-shirts and also helping raise money for that important cause of childhood cancer. Your class really stepped up and you did some great things, and that's when we learned that we have a lot to learn from you. Some of you came from humble backgrounds. You may have been the first in your family to graduate from college. You taught us all that it doesn't matter where you come from or what you used to do. It matters what you decide to do and what you work hard to achieve. As you transition from professional student to health professional, hard work will continue to serve you well. You have students in your class, like Dr. Weiner mentioned, that have come from all over the world, some just a little bit north of here, eh? They came to study in Davenport, Iowa, thinking that it was going to be warmer, perhaps, but then they survived the coldest winter in Iowa's recorded history last year. While here, they enriched this class with their respective cultures and reminded us that chiropractic, although it's an American-made, Iowa-grown profession, it's now reached the four corners of the globe, helping people from all around the world. Then your halfway party came and went with no injuries, fatalities, and thankfully no lengthy stays in the penitentiary. And then your class was in its home stretch. And then you really then realized that it's true what they say about Palmer going by fast, once you pass by second trimester anyway. I hope you might have learned along the way that it's not always the one with the fancy Mercedes or sporting the bling that's the most successful. Mabel Heath Palmer, the financial brains behind the college when B.J. Palmer was here, once said, "Money is a poor lens through which to measure success." I hope you'll remember that and keep your focus on what's really important, which is helping people achieve wellness through chiropractic care. These last few tries of Palmer really did fly by. You've barely noticed when you learned the procto and gyno exams and then geriatrics, I realize. You built your business plans with one foot out the door, it seemed, but now a couple hundred patient visits later, you get to cross this stage. But before you do, I ask that you remember a few things. And no, there will not be a test or a quiz at the end of the ceremony. All chiropractors are on the same team. Soon you will raise your right hand and make a promise in the form of the chiropractic oath in which you're going to say that I will refer and regard to my fellow chiropractor with respect and dignity, honoring them for their contribution to the profession. Each of you have a unique way of describing to patients about what chiropractic is and why it's important. Some of you will use very biomechanical terms, and some of you will use more philosophical words. But at the end of the day, you will adjust patients and help them get better. There's room for all of us in this profession. Keep your promise and honor your fellow chiropractors, all of them. Number 2, remember that quote from D.D. Palmer that I put on the bottom of your geriatrics midterm. I have never considered it beneath my dignity to do anything to relieve human suffering. Help your patients be well. Get them the care they need or refer them for the other care that they need, but either way, help them. Give each patient the same quality of care that you would want your own child or your own mother to receive. If you do, your patients, your profession, and your practice will all flourish. 3, remember too that it takes years to earn the trust of your patients and your community, and it takes a few seconds to lose that trust forever. Be an ethical doctor. Number 4, never forget that Palmer College gave you the foundation that you now have for building your life as a chiropractor. Be thankful for your Palmer roots. And last but not least, I would be remiss if I didn't remind you to do what it says at the exit of the B.J. Palmer Clinic, which is now the Campus Health Center. It says, "Go forth and serve." And by that I mean volunteer in your community. I said it to you in 8th try and 9th try, and I'll say it to you again. Volunteer. Give of your time when you don't have much money, and give of your money when you don't have much time. Muhammad Ali was once credited with saying, and I'm sure it was said by others, service is the rent we pay for our time here on the earth. So don't leave this earth without paying your tab. Now, I saved this till the end because I didn't want to cry the whole 10 minutes all the way through this. But Milad, your whole family is so proud of you and the kind of student you were, the kind of father that you are. I'm going to try to make it through this. And the kind of doctor that you've become. Job well done. And all of you, we look forward to seeing you again soon, maybe at homecoming, perhaps when it's a little warmer than today. Congratulations, Class 151. You will be missed. Thank you.